to Public Health America, a weekly program produced by BronxNet in partnership with Mercy College. I'm your host, Dr. William Latimer. Here on Public Health America, we speak with experts from an array of specialties across the liberal arts and health professions to provide you with not only the best science, but practical tips to live a healthier life. We also celebrate what studies have long documented, namely the unparalleled value of a liberal arts college education by setting the stage to pursue a career of your choice, increase lifetime earnings, and engage in civil debate. Our experts will share decisions they made and support they received that helped them to beat the odds. By sharing one or two life lessons, their stories may provide you with the inspiration and method to realize your dreams. This is Public Health America. Hello, welcome to Public Health America. I'm your host, Dr. William Latimer, here at Chestnut Hill College in Philadelphia, Pennsylvania. It's my pleasure to welcome to the show today Dr. Todd Matthews, Associate Professor and Department Chair of Sociology, Criminology, and Criminal Justice at Sacred Heart University. Todd, welcome to the program.
Thank you very much. Excited to be here.
Super. So I know you've been doing some cutting-edge work on food insecurity and food access, something that's so important today in urban and rural and just about every setting there is. Tell us a little bit about your work.
Sure, thank you. So as part of my interest in sociology and social inequality, while I was in graduate school, I had the opportunity to work as part of a research team 20 years ago that was looking at understanding this relatively new concept at the time of food deserts. So I worked on some early work that focused around kind of understanding what this new definition from the USDA, what it meant in practice across the United States, like you said, urban, rural areas. So food deserts officially are defined by the U.S. Department of Agriculture as areas that have either a poverty rate of 20% or more, or median family income that basically is less than 80% of the median family income compared to other urban or rural areas. And then the other criteria that's important is they also lack access to healthy food options, usually measured as grocery stores, full service grocery stores. So I had that opportunity to conduct that early work while I was in grad school that was kind of just understanding the terrain around the United States and the geographic diversity. And then several years later, I partnered with a colleague who is in public health and health promotion to work on several studies where we were able to kind of drill down and look in different states, not only at the issue of food deserts, but also then how that impacted health outcomes, specifically obesity, primarily in a variety of different states across the country. So that's been, we've published several articles in the last few years around those topics.
So that was a great definition of food deserts and very helpful. Tell us, what's the phase that your research is in today in looking at food deserts, food insecurity, and food access?
Terrific question. Yeah, we've actually kind of at the stage now of, again, we were kind of breaking it down by states. We actually published in several state public health journals looking at particular states. Now I want to take it back more nationally and focus on some of those other determinants. So another part of my research is very interested in civic engagement and civic capacity and how that can impact positive outcomes or create conditions for negative outcomes within particular communities around the country. So now looking at moving that research into that area to really kind of understand, what are some of the factors that are leading to greater likelihood that some communities become food deserts and as a result then have significant health outcomes, particularly for residents who are disadvantaged in terms of poverty in particular, or class, or other aspects of their identity.
And let me ask this. Give us a sense, either in terms of the states you've worked or nationally, given a definition of a food desert, like how prevalent is it? In other words, we all probably have, or some people have, preconceived notions that food deserts might be more prevalent in urban settings, but maybe that's not true. Maybe they're equally prevalent in urban and rural. But like, just what is the scope of the problem?
That's a very important question. We see ranges anywhere from 10%, for example, of the census tracts. So those are sub-county units. They kind of correspond to neighborhood, small city type of geographic units. I think they tend to be about 2,000 to 8,000 people. So anywhere from 10% in Hawaii, for example, to upwards of 20% or more in some of the other states that we've looked at. So it's a pretty significant issue. I mean, much like the poverty rate generally around the country, still hovering around 10 to 15% after decades of social policy and effort. Food deserts are a remarkably intractable and kind of pernicious set of conditions.
So that you set up my next question perfectly. If the rate of food deserts is 10 to 20% by state, and the poverty rate's been at about 15% for 20 plus years, despite numerous efforts on multiple administrations on the right and the left to make some change, what on earth can we do differently? And I'll add a complexity to that, and feel free to address one or both. And that is, what is the intersection between structural issues like the availability of healthy foods and individual issues like eating unhealthy foods across 3 generations? Like what, how do we even know how much those two things interface?
Well, I think you're absolutely right that all of those are factors. One of the things that in our research we've tried to control for as much as we can is, again, with the food deserts, in many of those cases, the individuals just lack access, whether it is in rural areas where you have to be, where a large percentage of the population is 10 or more miles away from a grocery store and maybe only has a convenience store that has a very limited selection of primarily unhealthy foods, or even in more urban areas where, again, getting around, especially for certain populations, can be very difficult. So even if you're only talking about a mile now, between access, lack of access in some areas to reliable public transportation, or certainly lack of access to an individual transportation, that can become difficult. And then the only places that are in your immediate geography, walking distance, are, again, corner stores, bodegas that have primarily unhealthy food options. So that's been a major factor. But one of the things that we tried to do as well with our research is we incorporated a look as well at farmers markets and some of the efforts that have been done with farmers markets as a kind of mediating structure there. So many states have, through their social service provisions, SNAP and other programs, have provided greater access and greater affordability by providing some vouchers and other funding for individuals who may be impoverished to gain access to food there. Now, traditionally, in some circles, farmers markets have been seen as primarily, maybe more in middle class or upper middle class areas, but increasingly we've seen a shift there in many major metropolitan areas. So until recently, I lived pretty close to Baltimore, and we would frequently go into the city, and there were some tremendous farmers markets that were available pretty close to very impoverished neighborhoods and areas, and then there were even food trucks that would deliver from some of those farmers markets to other maybe more remote and also impoverished neighborhoods. So there definitely are some mediating institutions that have been developed and are developing, and I think are increasing.
Is there any hard data on the extent to which residents in very low-income neighborhoods will actually access those farmers markets?
It's primarily case studies, anecdotal at this point, more individual case studies, but certainly, particularly when there is additional, not just the access to the farmers market, but also then some means of, food box vouchers, things of that nature that kind of offset some of the higher costs, because again, you are talking about for produce and healthy food items, you are often talking about a higher cost than if you again go and buy something that's not as healthy, what we call junk food from a corner store. So the combination of those in a number of studies in different metropolitan areas, in particular in different cities, has tended to show that yes, they are being utilized, but they are just a start.
Okay. So what do you see is with just a couple minutes left, what do you see is the most important things that need to get done to try to eradicate food deserts?
Well, again, going back to the poverty example, I'm not terribly optimistic about eradication, but even continuing to reduce their prevalence is significant because, again, the outcomes we know of people, especially children, who are malnourished and the other disadvantages that creates in terms of education and later life chances. Even if we're cutting those significantly, even by half, that would be a tremendous benefit to our society. So, I do believe that this has been a topic now that is of interest for multiple decades, and I think that there are initiatives that are working. I do think you said one of the key words earlier of structure, it being a structural issue. So certainly, until we can see some kind of structural, significant structural engagement with questions of poverty and inequality more broadly, I think that the continued existence of food deserts.
Fair enough. Thank you. We're going to take a quick break. When we come back, Dr. Todd Matthews is going to tell us a little bit about his experience in undergraduate college education and how that set the table for a profession as opposed to a job and the great work he's doing now. This is Public Health America. I'm your host, Dr. William Latimer. We'll be right back.
How do you know when you've made the right decision? It's the feeling you get in your gut, the one that tells you what's right or wrong. It's the one that says, sure, I can have a drink, or the feeling that says, okay, I've been drinking, now what? It's the voice inside you that says, I'm buzzed, better leave the car when it's time to go. Plan ahead, catch a sober ride. Buzz driving is drunk driving.
Welcome back to Public Health America. I'm your host, Dr. William Latimer. Todd, we always start this part of the show with the exact same question, and that is tell us where you were born and about some of your formative experiences.
Well, thank you for the question. And this is my favorite part of the show. I've watched a few episodes now and really enjoy this. I was born in Nassawattix, Virginia, which is on the Delmarva Peninsula, the eastern shore of Virginia. It's roughly an hour north of Virginia Beach, Norfolk, but it's a very rural area, which I think probably has spilled into many of my interests and issues. I spent most of my life growing up in that region, in the South Side Virginia, and then the lower Delmarva Peninsula of Maryland as well, a little bit south of Ocean City, Maryland, in a rural community, Pocomoke. And from there, went to Salisbury University for my undergraduate degree.
And did Salisbury University used to have a previous name?
Salisbury State University, yes.
Okay.
And it was Salisbury State College before that.
Okay. All right. So you went to Salisbury University. What were some of the decisions that went into attending college and then choosing that college or that university?
Sure. So I was by today's standards, a pretty traditional student in the sense that I was working full time coming out of high school, and um, I was for a first generation college student. My older brother had attended college, but my parents had not, and neither had others in the family other than an uncle. But I was, considered a first generation student, and I actually was working in radio in high school. So I had kind of a career emerging that I could have taken that path, but I really always believed in education and in the importance of pursuing that. And so I definitely knew that I was going to go to college. Salisbury was close to home. I applied to some schools out of state, but I wanted to stay close to home at that time. It was a relatively small school, small liberal arts school at the time. I guess it still technically is, even though I think it's over 10,000 or around 10,000 students now. So it's grown quite a bit. But it was an easy transition for me from being in one of the smallest high schools in the state of Maryland to a relatively small university at that time.
Very good. And what did you ultimately? What was your initial experience like at Salisbury? What did you choose to major in? And what was your experience like there?
Sure. So I started out as a communications major because, again, I was working in broadcasting, thought, okay, career and professional connection. I enjoyed that, but I also was looking for something broader. I had always been very interested in history and politics, political science, kind of those sorts of issues. So as a sophomore, I took an intro to sociology course, an intro to political science course, and foundations of philosophy course. Enjoyed all three of them, but sociology really resonated and grabbed me. I would definitely say part of that was the experience with the professor who taught the course, Dr. Philip Bosserman. He became a great influence and mentor and ultimately good friend of mine, who really encouraged my continued movement through my education and really kind of sparked my interest in scholarship, not just in kind of understanding scholarship, but engaging in it as well. So I really had a wonderful experience at Salisbury with Dr. Bosserman, the other professors ultimately in that department as well, and being able to, kind of ignite a latent passion that was there, but that I didn't really understand at that time, and really then, take it and it become a calling for me in a career.
Sure. And the major you landed in was sociology then?
Yes, that is correct.
Okay, great. And your description is so clear and wonderful that and we've heard this from other guests, that a really positive and critical element of your undergraduate experience was the mentoring link that you had to the doctor you just mentioned, the professor you just mentioned, and that it sounds like that extended beyond your undergraduate experience, that he continued to be a mentor. So clearly you either understood intuitively or directly, and of course he did too, the value of that relationship. And it sounds like it was something that you cultivated as much as he did.
I think so, certainly. And we continued, engaging each other, meeting. I actually taught a course with him, co-taught a course with him a few years later, while I was kind of taking a break from my studies. So I had that opportunity, and we actually also co-authored a couple of pieces that looked at a peace studies organization. He had founded a center for teaching peace at Salisbury, and worked on some other kind of more theoretical pieces as well with him. So it was a wonderful relationship that I really benefited from, and have tried to, as much as possible in my own career, emulate. I spent most of the last several years working with doctoral students, primarily at my previous institution, and really tried as much as I possibly could. And these are professional doctoral students who are working full time, so not the traditional, research assistants or teaching assistants, but tried as much as I could to really emulate that sort of a collaborative mentor relationship.
Got it. And did you face, and they don't have to be, it could be at any level, but were there any bumps along the road during your undergraduate experience?
Certainly. I mean, my first semester, the week before I started, my grandmother passed away, and I was very close to her. So that first semester, I really felt lost. And again, as a first generation student, and in the early 1990s, there weren't the same types of resources available. I don't say that in any critical way, because I do think there were resources. I just didn't know where they were at that point in time. But now I think that universities and colleges are being wonderfully proactive in providing resources for students with all sorts of different needs. And I think that's, amazing. And I try to support that and work with that whenever I can as well. After I found sociology, though, it really was a sharp turning point. I mean, things went really well for me as far as my education. And I had the opportunity to present papers as an undergrad, and then pretty early in my grad school experience, and was published while I was still a master's student, and then a fair amount as a doctoral student. But I also, at the same time, was always fairly engaged in my teaching as well. So, I always took those aspects of the roles of what it means to be a professor very seriously from early on. And I think that those early experiences and maybe even some of those early challenges have led me up to maybe be a little more empathetic and again, try to be as collaborative as possible, both with students and as well as with my colleagues.
That's great. Makes a lot of sense. So what was the next step? When, after you graduated with your undergraduate degree, what was your next educational step?
Sure. I was very interested in the relationship between sociology, so society, and the environment. And I found the nearest environmental sociology program, which was at the University of Tennessee in Knoxville. So packed up my car, my parents brought some things, and I left the area I'd grown up in and went to the University of Tennessee. Really enjoyed my experience there, and would have probably stayed there through my doctorate as well. But like many universities in the 90s, they were kind of struggling with their identity and resources and where they were allocating their resources. So I was actually counseled, okay, you may be better looking for another school, not because you're not a good fit here or anything like that, but just we don't have the bandwidth right now to really support very many doctoral students in that area. So I went to the University of Maryland, which was back in my home state, and then some family matters and other issues led me to leave there. And then one of my colleagues who I went to the University of Tennessee with actually stayed there, finished. He's a criminologist, and he started at Mississippi State University in Starkville, Mississippi, and that's where I ended up actually going for my doctorate. He recruited me to come there to complete my doctoral studies. So I did that, and haven't looked back since.
So what's really great about that story is that clearly it was a bit of a journey, right? It wasn't like automatic. You had to go to a couple of places. There were some family things going on, but you hung in there and you got to the place that made it work. And I think that's an important message to our viewers, that I think a lot of times for people that like you and like so many that are first generation college students, you don't know what the path is because there's no sort of immediate memory of what's been done by other people that went before you. And yet your path, while exceedingly successful, still was a journey that maybe you couldn't have predicted at the very beginning. Does that make sense?
Yes, it absolutely does. And not even at the very beginning, not only at the very beginning, I think various points in time there, I wasn't sure that was the route that I was going to end up on. And certainly not, I couldn't have foreseen, now 2 decades later being in a role like I am now. And having the many blessings in my life that I have. I mean, you're absolutely right. I'm an individual who, while I was a first generation student, also benefited from numerous privileges relative to many others. And so I know that the journey can be incredibly challenging for individuals. But I do fundamentally believe that, there are many people out there who are ready and willing to support folks who may be struggling or not quite having figured out what it is they're looking for yet. And I think for many, education and moving through an educational path like this is one that can be attractive and appealing, and that those individuals can bring a lot to the conversation, a lot to what we're doing.
So that's a perfect segue into just with a few seconds left. If there was one piece of advice you could give to our viewers who may be on the fence about whether or not to attend college, what would that advice be?
Well, I do understand, first and foremost, college is incredibly expensive now. So I do recognize that. I do hope that whatever decisions they make that are best for them, whether they're 18 or, maybe they're looking to go back to school later in life as well. And as I know, you have a very diverse audience, that, they take the time to talk to individuals, talk to folks who are on the campus, talk to faculty members, and maybe they'll hear a story like mine. I think there are many of us out here, faculty, staff, administrators, who are here primarily because we want to, again, support those individuals who, are at an important point in their lives and are asking those questions. And we do recognize that there are some very positive outcomes that can come from being being part of the higher education system. And we also know there are challenges, so we want to support individuals as much as possible. But I think just being open and talking to folks and kind of learning more about what's there and what's available may open pathways, like in my own experience, that I never would have thought of at age 17, and then 2 years later I'm pursuing them.
Excellent summary, and thank you so much. I want to thank Dr. Todd Matthews for joining us today. I want to thank our viewers for tuning in. I'm your host, Dr. William Latimer. See you next time here on Public Health.